Hello. Uh, Hello. Hi, everyone. Good day. I'm live now. Sorry, my mic was a bit messing up. How are you doing today? How's been your day? Yeah, I've had a very good day. I hope you've had a good day too. How's good evening and good morning or good night from wherever you are, watching me from. Uh, Today, this moment, I am going to be discussing a very important topic. If you can see the thumbnail is talking about not being functional somewhere and functional somewhere else. I was privy to um, an information on the blue app called uh, Facebook, and this is the information I got. It says, "Hello, Dr. Shola. Anytime I want to make love to my wife, I always have erectile. I always have erectile dysfunction. I see this as a serious difficulty because of that. I have tried to have sex with various girls outside, and I will perform very well without having ED. What he's talking about is that each time he tries to be with his wife in bed, he has challenges, but if he tries it with other women out there, quite very easy. But when it comes to my wife, I will be having ED. I don't know what to do, and I don't see myself having any problem. I am a physically very fit exercise wise. I am very fit. I am a physically very fit exercise wise. I have been married for 4 years now with 2 kids. I need advice. This is what I saw, with our brother. And I decided to carry out a bit of a research to be sure what exactly is going on with this brother who's saying he has ED. But if he's with other men, other women, it functions quite well. So I went online to get some information, and this is what I got. What is erectile dysfunction? Erectile dysfunction, ED, is a consistent inability to get or keep an erection firm enough for satisfactory sexual intercourse. It's a common condition, especially in men over 40, but can affect men of any age. This brother did not tell us whether he's above 40. So we wouldn't know. But now the research I did said it can affect anybody at any age. It says the major causes of erectile dysfunction is often a symptom. Erectile dysfunction is often a symptom of an unhealthy or of an underlying health problem. Causes can be physical, psychological, or a mix of both. And he's now breaking it down to physical causes, which is the most common. Number one is cardiovascular issues. That has to do with the heart diseases, clogged blood vessels, atherosclerosis, high blood pressure, and high cholesterol. This impair blood flow to the penis. The next physical cause is Diabetics. Damages blood vessels and nerves that control erection. That's what diabetic does. It damages the blood vessels and nerves that control erection. There is also neurological conditions. This is multiple sclerosis, Parkinson's disease, spinal cord injuries, or stroke. They are also part of what causes erectile dysfunction. Hormonal imbalances, that is low testosterone levels, which is, 1 minute, my screen is blocked. Low testosterone level called hypogonadism. Hypogonadism. That's a big grammar there, right there. Oyinbo no be my language. Then medications, men that take medications. It has side effects from drugs for blood pressure, depression, anxiety, or post-treat conditions. So when you're taking medication can affect, what do you call it? Erectile dysfunction. Lifestyle factors. If you're smoking, it damages the blood vessels, alcoholism and substance abuse, obesity, lack of exercise. All of this, they are major causes of erectile dysfunction. Other medical conditions like kidney disease, Peyronie's disease, that is the scar tissues inside the penis, sleep disorders, or treatment for prostate cancer. These can cause erectile dysfunction. Second thing that causes erectile dysfunction is psychological and emotional causes. If you have depression, anxiety, or stress, relationship problems, performance anxiety, mental health disorder, all of these are major causes of erectile dysfunction. Then, what is the cure and treatment options? There is no single cure for all cases of erectile dysfunction. However, it is a highly treatable condition. Highly treatable condition. The right treatment depends on the underlying cause. The first and most crucial step is to consult a doctor, a urologist, or primary care physician for a proper diagnosis. So, number one thing in terms of treating is your lifestyle. Lifestyle changes, which is the foundation of treatment and prevention. You have to exercise regularly. This exercise will improve blood flow and cardiovascular health. Exercise will also, if you do lifestyle change, you have healthy diet, a heart healthy diet that is Mediterranean style can improve erectile dysfunction. If you go using the Mediterranean style of diet, then you have improved erectile dysfunction. Next is weight loss. If overweight, losing weight can significantly improve erectile function. If you quit smoking and limit alcohol, that could also help. Manage stress and sleep. Get adequate sleep and practice stress reduction techniques. These are another thing that can help with erectile dysfunction. Number two, in terms of treatment, is medical treatments prescribed by doctors. And this definitely will be oral medications. That's the PDES inhibitors. The most common first-line treatment. And the examples include sildenafil, that's Viagra. Well, that's Viagra. I'm not an English major. That's Viagra. The second one is Cialis, which is tadalafil. The next one is vardenafil, that is Levitra. Avanafil, that is Standra. And how do they work? They increase blood flow to the penis. They are not aphrodisiacs and require sexual stimulation to work. So the next one is testosterone replacement, which is testosterone replacement therapy only if blood test confirms low testosterone. So some people have low testosterone. You'd have to get blood tested before you can use this kind of treatment, this therapy. Other medications, which is adjusting or changing medications that may be causing erectile dysfunction as a side effect. So devices and procedures. There's vacuum erection devices. That is a mechanical pump that draws blood into the penis. Then there's penile injections or erectile suppositories. That's medications self-administered to induce an erection. There is also penile implants. That's surgical option for men who do not or don't respond to other treatments. Inflatable or bendable rods are placed inside the penis. That's serious. The fourth one is psychological counseling. If psychological factors are primary, like anxiety or depression, seeing a therapist or a sex therapist can be very effective, often in combination with medical treatments. But what not to do is do not self-diagnose, diagnose or buy unregulated miracle cures online. They can be dangerous. They can be very dangerous. And they contain hidden drugs and worsen the problem. Do not ignore it. ED can be an early warning sign of serious cardiovascular disease. Seeing a doctor is vital for your overall health. Now, the key takeaway from this is that erectile dysfunction is a common medical condition, not a reflection of masculinity. Successful treatment starts with an open conversation with a healthcare professional to identify the cause and create a safe, effective treatment plan tailored to you. So that is what I got for erectile dysfunction, the research that I did. But from that post, you need to see comments. You need to see comments from people. The comments were so bad that it was crazy. This 1 minute. I want to. One of the comments that I got. Sorry, 1 minute. Before we go to the comments, let me do this. Let me play something for you that a doctor actually worked on in terms of comments. Because I was taken aback myself to say, really, does it mean that this could be a reason for erectile dysfunction? Please watch it with me.
Thanks for staying with us. All right, so we still have our Dr. Abasi here. I have a question for him, Carol. She says that some men struggle to sexually satisfy their wives, yet this doctor is encouraging men to take on multiple women. This is deeply unfair, as many married women are left feeling unfulfilled, leading some to even resort to adultery or using sex toys to meet their needs. This happens.
Absolutely, honestly, and that's one of the mantra of Heritage Men's Clinic is we are not encouraging just sex. We're talking about love making, because women complain if a man is a 2-minute man. That's one of the things we fix. Women complain if a man is not getting erection in the morning, because those are the one early signs that you should be looking for. If your man wakes up and his man who doesn't get up, that's the problem for cardiovascular. So yes, we are strongly at Heritage, we're strongly against a man that is unable to satisfy his woman. Yes, I'm advocating the 21 times because it benefits, but it's not all men that will be able to do that. Our own job is to be able to make sure that your man can actually do love making with you. Women are like oven. You need to be preheated for you to enjoy sex. Men are like microwave. We get turned on easily. So there is a natural discrepancy, and that's what Heritage is trying to fix.
Okay, so I'm going to blame you and your men counterpart. So every time we hear women, they'll say, check for breast cancer, check. I'm just finding out that lack of morning erection is the cardiovascular.
Absolutely.
I've never heard of it. So why are you people not doing the campaign for that? As much as women, we talk about cervical cancer. I do an awareness every 3 years. I'm due next year. We do our breast cancer checks. I know how to do it. Every young girl knows what to do once they approach a certain age. We check. But we don't hear men.
No.
How often do men come in for, is there a particular kind of test, that they do for a diagnosis as regards men's health, and then how often should men be doing this?
No, fantastic question, honestly. So we live in a very conservative society. Talking about sex is still considered taboo. So when you're asking men, when they come into my clinic, the sign is there. It's like, do you wake up like this, or this? C is a full erection. And we tell them, if you're not waking up with a full erection, you're already having cardiac problem. That's not Dr. Abasi. This has been proven.
So this erection,
yes,
up to what age? If you are 80,
fantastic.
Are you supposed to?
My oldest patient is 92. He has a 4-year-old daughter, DNA proven. This is not somebody that swapped. Not by IVF. So ability for a man to wake up with an erection has nothing to do with age. It's all about blood flow. If your heart is pumping, some men woke up today, they're talking, they're alive, but they cannot raise their left hand because there's stroke, no blood flow. If I wake up and this guy doesn't wake up, there's problem.
He said this guy. The guy, not say.
There's problem.
So
we have to get out of the conservative.
I have a collar.
Okay, you have a collar. I have a question.
This your show is preparing your body like this. A day from London. Thanks for calling.
Good morning. I'm enjoying that, doctor.
I'm sure you are.
I have a question.
Yes.
Yeah. I have a question for the doctor. My question is that what are the fates of the Catholic priest who doesn't get married?
Thank you very much, sir.
An excellent question. And they live long. Wait now. They did a study. They also considered nuns. They look at nuns. And they were looking at 80,000 nuns. And they looked at the people that were sexually active. This has to do with women. Because the nuns that have never had sex at all, they had the highest risk of breast cancer, ovarian cancer, and cervical cancer. So for the men, we're looking at how to even access them. Because whether you believe it or not, why are the Catholic churches settling? Because all these people are doing things behind the door. Honestly, that is just the truth. So let's get out of the old society, the conservative thing, because we need to really face the reality. Your question earlier was about your daughter and your son and saying, look, we tell them in church, stay, abstain, do this, do that. They looked at sexually active young girls. Their risk of breast cancer is almost zero. What you and I should be paying attention to is, when is my daughter starting her menses? If she starts her menses before the age of 12, you are carrying 30% risk of breast cancer, whether you are there or not. And the same thing goes for your son. If your son is not getting rid of his DHT, trust me, I'm not wishing it on him, but it's going to develop enlargement of the prostate.
All right, so societies. I have a question.
Wait.
Let me ask you.
Brian is the best content marketing team lead I've ever worked with. But before he created his content calendar using Monday.com, his strategy was, let's just get something out. Now with Monday.com, he easily created a board to plan and coordinate the whole team's assets. It has everything a content team needs.
I wanted to ask, because I hear all this. I am 80-90% in agreement with you. I can't argue with you. But in this day and age of sexually transmitted disease,
Excellent question. Yeah.
You are telling men to go out and have sex. They will go and catch
what they should not catch.
Yes. No, I agree with you. And that's where we talked about society awareness and all that. So at Heritage Men's Clinic, we treat STIs, and we let people know that we let people know that we let people know that the condom is not even 100% protected, but we advise it. But the other part of the society you and I are not talking about, some men, because I do advocacy in other countries, they are telling us that the cost of condom is even too expensive compared to what they're going to pay the Olosho or pay the girl. So we have a bigger problem.
We have me, I know that one. Please go ahead. I don't mind.
So we have a bigger problem on our hands. But the truth of the matter is, even the girl, whether contracted or not, she does not want to carry diseases. So the men themselves, they are not going into the rain without raincoat. We advocate, we tell them. So when they come in, STI is part of what we do.
Yeah.
We check it. Because there are certain STIs that you and I may have and we do not even know.
But let me take this call. Precious been holding for a while. Good morning, Precious. You're live. Hello, Precious. I think we lost that call. Yes, talk by. Okay.
It's almost as if, the devil has come to take over society.
Exactly. You're like the agent of the enemy.
When
the pit of hell.
Ancestors, even in the ancient books, the Bible, the Quran, age of marriage was quite young.
Yes.
We will go and put it at 18. Now you say 18 old.
Yes.
You say they should start more. Are you going to advocate premarital sex? Are we going to advocate extramarital sex? Are we going to advocate everything against structure?
Solution.
Because structure is what marriage and society has put on
ground,
such that bastards are not flying everywhere, so that
diseases,
children are not misplaced. Bomb over for should carry the one for the wrong and give the wrong.
Yes.
So that there's a structural society, things are done normally. Yes. Now we bring this solution, scientific researches, there are gays, there's everything. It's like
it's confusion.
It's the end time.
No. Look, this is a legit question, and yes, you take me to the moral angle. Unfortunately, I'm not a pastor, I'm not an imam. But let me tell you the other angle that we look at these things from. When my grandparents got married at 16, 17, and she was considered old, what did the society do now? Look, I'm a feminist. I want my daughter to get PhD before she even looks at a man. But I also know the risk that the older she gets, our egg reserve is gone down. Men make sperm every day. Women only have one fertility day a month. And yet I want to be a grandfather. I want her to get a PhD before she even says hi to any guy. I have to pick. You have to pick one.
Okay, let me take Sarah. I'll come to you for a second. Sarah has been holding for a while. Good morning, Sarah. Well, last go ahead, okay.
All right. So I love that we're talking based on fact. I want to be sure that I hear you correctly, because whenever we talk about sex or we talk about relationship, we put the burden on a woman being humble, a woman allowing her husband to go out, and we never look at the perspective of the woman. When we talk about infertility, historically, they put the responsibility and the burden on the woman, knowing scientifically that about 50% of case of infertility is caused by men. So your statement that you went viral with was the fact that prostate cancer will reduce if men do 21 times.
Yes.
But you also now said that women also would have less risk of breast cancer. Please, I want you to expatiate on that statistically. What would make a woman have less breast cancer?
Fantastic. More sex. Hear me again. More sex. It's unfair that our society that our society blames infertility on women. It's unfair. We don't preach that.
So before we continue with the video, can you hear what he's saying right there? It's important that I think dysfunction is caused by inconsistent sex. Let's watch what people are saying from the comments that I talked about. From where I got the topic from. Ajayi Obe said, "My man, simple solution. Your problem is you are not exercising. Go and start doing some daily routines. Cut down on your alcohol beverages. Your problem is not spiritual, or you are not finding your wife attractive, but some blood circulation issues. Start daily brisk walking or jogging for an hour a day and praise God later. Joe Mike Ochono answered Ajayi and said, did you read where he said he's physically fit, exercise-wise? Go and read it again. It's not about exercise. So it might be purely psychologically. It might be purely psychological. He responded, did you read the post at all? Then the guy said, let me go to the next page. He said, erectile dysfunction. Sorry, 1 minute. Ajayi said, erectile dysfunction. Oh, what's wrong with my this thing? What the hell is this? 1 minute, please. He said, the guy said his erection outside marriage, but not with his wife. Not with his wife. Some wives are dirty. Some don't change their undies, etc. That is very funny. And that is possible, actually. Tony Ejimadu said, it has nothing to do with medical problems. It is psychological problem that can be solved by scarcity. Both of you need some space. That makes sense. Caroline Tobiloba said, obviously, this is a spiritual problem. It is either one of your various women did it to you, or you don't chop palm, we get incision, or your wife too now, or more, we get work for body. Hey, God, I beg you. Madam here, Caroline has done it spiritual, and it's possible. We never can tell. But Olumide replied Caroline and said, you might be right, and which is true. That's what I just said. Olorun Juedalo said, you just nailed it, sister. Exactly what happened. It don't already enter one chance. So people are already timing it to be spiritual. Christy Joel said, most likely you don't find your wife, you don't find your wife attractive at all. That is a possibility as well. You are outside already. Do you think your wife is not suffering too? Take it easy with the testing. Too many STI outside. Communicate with your wife, I beg. That's another solution, which I think. Frank said, nothing medical about this condition. A lot of married men are in this position. You don't find her sexually arousing anymore. You don't find her sexually arousing anymore. Adewale, which is possible, that's true. I think most times when people are in a relationship or marriage, you get to a point, they call them over-sabi, see finish will come in, and you start, seeing your wife like she doesn't really, count anymore. She's not attractive anymore, kind of. Things like this cause erectile dysfunction. But I would advise, I don't advocate cheating. I advocate that you spice it up and try and spice up the relationship so that you can find your partner attractive again. It also happened to women too. Sometimes they don't find their husbands attractive and they want to let go. Adewale Modupe said, Ogbeni is under an influence. Stop doing it outside and go for deliverance. Nothing like ED. When you are with your wife, something from those outside is responsible. Go back home with your full mind. Stay with your wife. She's advocating for the woman. Awit said, that's what familiarity causes. Just like I just said. That is what familiarity causes. Take a week break from her and see her in a new light when you return, and do that once in a while to spice up relationship. That's a fact. Just spice up your relationship and you'll see that there will be a change in your this thing. Let's go back to the video. Let's finish what the doctor said. The doctor said, let's continue with what...
Because we know it's 50-50. And it's getting worse, that even more men are even doing it. We don't have time for that show here. In Lagos, most men drink only bottled water. Bottled water decreases your sperm motility. That's for another conversation. Yes, to your point. So what is it that women need to do to reduce breast cancer is have more sex, and don't settle for a 2-minute man guy. Settle for a guy that will get you to reach orgasm. When women reach orgasm, she releases more oxytocin. Oxytocin will short your chance of breast cancer.
So this thing even goes both ways. Now the doctor is saying that even women too need to have more sex, so that you don't have breast cancer and have all the cervical cancer that is common these days. So it goes both ways.
Quote me and quote Harvard Review. So more sex.
What are women who are not having sex at all?
Good. That's the study about the nulliparity. The risk actually goes up in terms of reproductive cancers, breast cancer, ovarian cancer, cervical.
Right,
or for women who has not had any child.
Let me bring in another, still within the balancing act.
Wait, I don't want to lose this caller again. Bella, okay. Hold it for a second. Bella, are you there?
I'm there.
You're live. Go ahead, please.
Thank you very much. I have in addition to what the doctor is saying. There is no how a man will just live without having sex for a long time that he will feel fine. And even in women who are sexually active, they are more healthy, they look more beautiful than the ones that are not having it for some time. And another thing, I want to show you this morning. What we eat will determine what comes out of a man. For example, the evening groups you people are using now usually decrease the sexual activity of many individuals. Let's say somebody that is taking this magic or whatever you call it. It's depressing the sexual center in the brain. That is why young people from the age of maybe 30 or 40 or thereabouts, most of them cannot perform. That's because
Meet AI Draft.
So yeah, let's continue with our comments so that we can, before we go back to the video. Susie Abby said, "Go and pray very well. The devil is attacking your home and your marriage. It's the trick of the devil to make your wife believe that you are impotent. Then quarrel starts, then infidelity on your side, because you will want to prove that your wife is the problem and that you can do it with other women out there. Please pray very hard to overcome this. Do deliverance also. God will deliver you. Talking from experience, bro. Don't give up. If you truly love your wife and want to keep your marriage." Well, this man says, or this woman is saying, is talking from experience. How that is true, I don't know. But I don't think prayer is not a matter of prayer here. If somebody has erectile dysfunction, he's performing well outside, but the wife is not enjoying him because he's not getting it on. That means something is wrong medically. For me, that's what I believe. Or the attraction is no more there. Egbe said maybe your wife also needs to go out to find out mojo. This on unilateral outing is not good. So two can play the game here. That's what she's saying. Ngozi said you have many girls outside, so could be you have charm and he's not attracted to you anymore. That's the only reason. That's the only reason. That's possible. Hella said the lady may also be testing outside like you. You people should continue deceiving each other without solving the problem. That's a possibility too. Obianuju said, it's obvious your spouse doesn't appeal to you anymore. It's best you sit down with your spouse and have conversations about it. Also leave other women alone and focus on her. Let me take this last one. Sometimes one becomes too weak. That's from Ogbeni. Sometimes one becomes too weak to have sex with his wife because she is always around. I think you need to take your wife out. Take her let her dress sexy. Sometimes also playing football on the same football field every time makes the game boring. That's why football clubs play away despite having their own field. Take her to a hotel, use another field. You will thank me later. That's a very good advice. What do you guys think? That's a very good advice. I think if you try other methods, you try, doing other things, and try, like you said, other fields and all that. It's possible that it could be better off than maybe just doing it in the house all the time. It could be better than that. Let's watch this other video and see what the doctor said again.
Social media went wild, and his bold claim that men should ejaculate at least 21 times a month set off one of the biggest conversations we've ever had. Well, he's back. And today we are taking things even deeper into a global crisis shaking families, relationships, and the future of reproduction itself. Global fertility decline. Is there still a need for paternity DNA testing? As birth rates drop worldwide and societies age faster than ever before, what does this mean for trust, parenting, and modern partnership dynamics? Does declining fertility make DNA testing less necessary or even more important? To break it all down, we are joined by the man who never shies away from hard truths, Dr. Rashid Adedapo Abasi, MD, Chief Medical Director of Heritage Men's Clinic, a leading voice in men's health, fertility, and sexual wellness. We will be unpacking the real forces driving global fertility decline, how this shift affects paternity questions and DNA testing, the impact of modern lifestyle, health, and societal pressure on reproduction, and what couples must understand as the new world enters a new fertility era. Brace yourself. This is just not a conversation. It's going to cut deep into challenges, assumptions, and just might reshape how you think about the future of the family. Welcome to the show.
Good morning. I'm Dr. An Nguyen. I am a physician specializing in allergy and immunology here at McGovern Allergy Clinic. While my mentor and
my pleasure. Thank you guys for having me. Thank you.
So we've been pondering before we enter the topic for today. And the last things you said the last time you came, where you advised that men should have at least 21 ejaculations in a month. And we've been checking because we have men. I don't know about my chica sister, I don't know. But the majority of us on the table have men, right?
Okay.
And we're now checking to see, can our man actually handle 21 ejaculations in a month? Or is it not too much for them? Because people have said from the last things, and I think you mentioned it, that a man needs more than one woman to be able to achieve that. But do they have the energy to actually achieve 21 ejaculations?
Yeah, actually, and it's not just in defense of men. What the data actually tells us that the decision of that 21 lies with the woman. Out of every 28 or 30 days, you guys have about 5 days off for menstrual.
Okay.
And if the kids are involved, the man is no longer number one, it's now number 2 or number 3. So there has to be allotment of that time. And we know that there's going to be some physiologic changes. If you've been married 5, 6, 10, 12 years or more, the man is not going to be chasing you the way he was chasing you when he was trying to get you, or your first few years, because the pheromones are just going to be separating. The pheromones are actually the key thing. The first time he laid eyes on you, it was the pheromones that made him just click on you.
Okay.
You may be the most beautiful woman there, but there was some other competition. But he felt on you because of the pheromones. So after a few years, the pheromones are not going to be that strong again.
So that is what the doctor is saying there, that over the years, the attraction declines. That is the pheromones that he's talking about. The attraction to the woman declines. Let's listen.
And physiologically, let's just face reality. So women are only ovulating 1 or 2 days a month. You have an ovulation window of 4 days.
Yeah.
The man produces semen every day. So even if you are ready, you are only going to want him around that your ovulation window. But he's ready for you anytime. And I see that I have the data.
Doctor.
But the reality is men thrive on varieties.
For you, sir.
So No. It's what the data says. I'm not here to defend men. I'm just telling you the basic facts.
This data.
So what the doctor is saying invariably is that a man who is having erectile dysfunction, like my brother is saying, that is trying other women out there, that's the best thing to do. The way he's going out and having it out there, that it's the best. Is he can have it with his woman, but I think he needs to spice his relationship up. But it needs more than one woman. That is what the doctor is saying.
Writing on variety.
Yes. Man cannot live by bread alone.
Women,
I understand. So for a woman, sexual intercourse is more than just physiology. A woman develops emotion. It's extremely difficult for real women to just be naked every time with different men. You guys just don't do it. For you, sex is more emotional. For a guy, sex is like food. It's a physiologic thing. Some men will have sex with some women. They don't even know what her name is. And they could care less. They're just moving on. It's a physiologic thing. It has to do it and move on. But for you, it's extremely difficult. You can remember your first encounter. You can remember the one in high school and all that. Men are not like that. We're just not wired that way.
So the person who did this wiring should be asked questions.
Yes. I want to appreciate you, sir.
Thank you,
because you don't know what you did for me. You gave me evidence. So now, when I want something, I'll just tell my husband, oh, you know that you need 21 days.
Absolutely.
I'm asking now. You are now saying,
I'm trying to help you.
I'm trying to help you. Help your prostate. Do you not remember the doctor said you need 21 days? So please, come home early so that you can do your 20. So you have really helped some marriages. You have helped some couple by giving some women this data to use to support
their husbands.
Their rights to their conjugal obligation in the other room.
Okay.
But for me, I feel that to a large extent, the issues around sexuality between husband and wife is usually reduced to the man's need, women satisfying the men, without properly understanding the fact that if it is extremely mutually beneficial, if that process is mutually beneficial, one person will not, the woman in most cases, which is where the data would lean to, that says, I'm tired, my kids, all of that, would obviously want it.
Be ready.
So, so sometimes the conversation that, and it's weird because nowadays I realize my children read my chat, they pick my phone and read my chat, so that I delete those kind of suggestions. I delete things, but I look at it that I'm having headache. I've been so tired today. You need to come home early. But you know it's 21 days. So I use the excuse, but I understand that I would have fun. So when I hear women saying they're not interested, I'm like, do you enjoy
what
it?
You're doing?
But whenever we have this conversation, it's always on the fact that women are not giving men. It's not capturing the other side that are men satisfying what the men need.
No, you have a valid point. Honestly, no jokes about it. And that's why in our own clinic at the men's clinic, what we focus on is we don't want men to just be 2 minutes men. See, by nature, men are like microwave. When we see a beautiful woman, our body goes 0 to 60. But you women, you are like an oven. You need to be preheat. So when a man cannot physiologically stand, even maintain his own erection, he's less of a man. That's what we deal with. Because you're right, women actually enjoy sex more than men. You just need to get that woman to reach orgasm. You need to get her. If you really get her there, she will be the one chasing you. So the 21 times will not be a problem. However, you guys have a lot of other focuses. When the kids are involved, you're just not even paying attention to us anymore. And because you guys believe you are the woman of the house, you are not doing what you did to catch us. No. Let's face reality. So when we were chasing you and when you were interested in us, you made sure
we're looking good.
You're taking it back to men.
Exactly.
Women.
No. But that's the reality.
We're looking good.
You are looking good. You are looking good. But now, because you know the man has gotten you, the ring is there, it becomes number 2, number 3. It's all about the kids. Before, it wasn't about the kids sleeping time. Now you cannot do it in the kitchen, you cannot do it on the... No. And men, you calling your husband and telling him to come home now, we actually discourage that in the clinic. Because men are not like machine. We advise our patients, don't know when your woman is ovulating, just know when she starts her period. Because when a woman is that ovulation period, you guys are like so focused on it. Come home now. The guy is not going to be able to perform. You turn him into a machine. The anxiety will be there. But just let him know where the window is. He has 4 days, and if he turns you on well and he plants his seed, the seed will stay in your body 3 to 5 days.
Okay, so I want to ask
Yeah, so let's leave it there. That is the doctor right there. He has summarized it for us, and I will end the show right here. That a man, I think, needs variety. And if you are not the type that can cope with a man that needs variety, just like the doctor said, please spice up your relationship, spice up your marriage, and you will see that your erectile dysfunction will disappear. I leave it there. Thank you very much. If you're watching me, please like, subscribe, and press the notification bell for this. And we look forward to, having your story. You can send your message to the number and the email that is scrolling on the screen. I will always come every day. I'm hoping that one day I'll be able to create a live show on my channel called Eating Pain, where I can discuss the challenges that men face in their marriages. Thank you very much. Have a very good night, good morning, and good afternoon, wherever you're watching me from. Bye.